Let's go ahead and dive into it. So, first, I want to start out with the significance of health communication, and especially in today's day and age where individuals have multiple different platforms through which they can receive information, right? So, I have a few of those listed here on this slide, where number one, we are dealing with not only uh, um, different sources of information that are coming from, let's say, social media outlets, your television, your news stations, and I'm sure you all can think of a lot more, right? But all of those actually tend to be coming out in the form of decentralized information, right? Which means that there are less checks and balances with what's being put out there for the mass public. And so, even though that does provide a level of autonomy and flexibility and being able to especially rapidly send out messages, some of that traditional expertise and the boundaries of making sure those checks and balances are there are not always seen, right? And so many of the organizations that I've worked with, thankfully, we all do try and reference those credible sources. And historically, that has been the Centers for Disease Control for many of the subject areas that I've worked in, right? And you all may also be familiar with other federal agencies like HUD as well as HRSA, right? The Health Resources and Services Administration. And of course, for those of you in the substance use work, I'm sure you're familiar with SAMHSA, right? And the guidelines that they put out. So thankfully, those are good references to have, but still, we do hear quite a bit from some of our direct service delivery providers where patients come in and tell us about information that actually feels incorrect, right? So maybe that's a result of misinformation. It could be, differences in understanding, whatever would have occurred, right? But it definitely gives us a signal that there's definitely much more that we could be doing around ensuring accurate delivery of health information. There's also increased grassroots participation and also overcoming traditional divides and barriers in how we communicate. And this really talks about some of our legacy systems of communicating information, where in today's age, technology is a main source. However, we do still see, because of our collective cultures or collectivism, where word of mouth information sharing is still very much prominent. Um, so, with all of everything that's coming out, there's not only an implication for us as providers, but also for the communities, right? Increased responsibilities for them to be informed. Ultimately, there is a responsibility of shared decision making that takes place and making just general informed decisions about our health, right? And so our communities are, coping with an increased quantity of information. They also are processing what they're receiving for relevance and accuracy. And so that's where that trust factor really comes in. Using organizational symbols and signs like logos and at the bottom of any material that's being put out, making sure that citations are there so that someone could actually dig into the credibility of the information being provided to them. And then, of course, acting on it to promote their health. And from a health equity perspective, it's always important to keep in mind to meet our communities where they're at, as we know, right, that everyone will have different cognitive, social, and material resources to be able to deal with such an influx of information. Now, I'm sure you all are familiar with the social ecological model, and why I have this here is really just to have us think about communication through the lens of this framework, where essentially there are a couple of main ways that we are communicating. The first is just micro level communication, that is just direct communication with the individual. Let's say if you are maybe working in the navigation space, or if you are doing disease investigation, with our fellow epidemiologists, a lot of that's happening one-on-one with the client. So that's what I mean when I say micro level communication. And then kind of moving broader beyond that, we have our macro level. And so that would encompass the messages that are coming out broadly from the different agencies that we represent at this institutional level, and then just kind of spreading through our community. And then, of course, if there's any policy level implications, right? With our providers' role specifically, I want to now talk about, the way that public health programming tends to take place, right? We have one arm that is prevention focused, and then we have another arm that is a little bit more responsive, right? Where from a tertiary prevention standpoint, individuals may be coming in with symptoms, maybe require an evaluation, require treatment, and maybe ongoing care. What we have showing up here on this screen is what is known as the prevention and continuum of care framework. Again, might be familiar to some of you, right? And so this framework, I feel it's very important because no matter what our role as public health prevention providers is no, no matter what that role is, we still have a part to play at essentially every level of this continuum of care. Inadvertently, even if our role is in prevention, we may still be informing some of the treatment that goes on, or maybe if we've connected a patient or a population with different services, that still informed the ongoing linkage that they've received, right? As we're thinking about our own communication strategies, thinking about kind of the trickle down effects of those messages becomes important. Over on the right, we see some examples of micro and macro level interventions at each stage of this continuum of care. So these examples of interventions include advertising. So what we do in our agency is we actually contract out with advertising vendors, and we actually work with them to design ad campaigns that could be focused on different levels or stages of this continuum of care. Other intervention ideas include entertainment education, media advocacy, media literacy, developing partnerships with our community members. So in our current program, um, a lot of the community-based organizations that we work with actually have very strong partnerships already developed with community leaders. We're able to not only help develop those, but also leverage them in the time that we need important messages to be pushed out. And then others that I'm going to spend more time talking about include social and health marketing, as well as social media campaigns. And so these last few that you see are definitely more of that macro level intervention um, that you'll see as they're implemented. Now, I mentioned, the flow of information also going through interpersonal channels, right, as part of the traditional divides that we talked about a couple slides ago. What I aim to kind of get kind of communicate through you all to you all here is with every single individual that we encounter, every community that we're working with, they of course are connected with others. And so our epidemiologists are actually fantastic partners who can actually trace back using different methods like whole genome sequencing if we're working with laboratory data, or through disease investigation interviewing processes to figure out where there may be linkages between individuals who are either exposed to different disease or who have tested positive for it. So what you see on the screen here is an example of a social network map, where at the very top you have the red bubble, the red dot that kind of shows us where the first case or the first exposure occurred, and the number of individuals that may have been impacted by that just by being connected to this individual's network, and then from there who they're connected with, so on and so forth. Having operated a patient navigator program currently within our sexual health program, we currently do what is called HIV PrEP and PEP navigation. PrEP is essentially a method that is used to prevent HIV. And our navigators are actually brought on board just to help individuals get connected to this prevention medication so that they could learn more about it and determine if that's something that they want to actually uptake and see a provider for. And what we're actually seeing a lot of recently is we have a high Colombian immigrant population that's come in to our clinic. And it started with just a couple of folks who were seen by one of our bilingual Spanish speaking navigators, and who was able to confidentially provide service, knowing that these individuals, based on what they had reported to us, were at greater risk of acquiring HIV. And so linking them in again through confidential means, and a lot of the times we're able to even do anonymous services to a certain extent that is allowable by law. But after those couple of patients, we actually started to see more and more individuals who, by word of mouth, had heard about this clinic that had helped them, and similarly wanted to receive the same service. So that is an example of interpersonal communication where there was really no messaging involved from a macro scale, but a really thoughtful approach from our navigators to, at a micro level, still get that awareness messaging across, so that people could learn about this prevention method. So that was just a couple of examples on my side, and I know I've been talking for a few minutes, so let me go ahead and turn it back over to you all. Tell me a little bit about how you communicate with your communities. Are you doing kind of similar type of work as I'm describing? Is there something different that you're doing that'd be helpful for me to learn about? I have some guiding questions on this slide as well, if you feel maybe that would be helpful. Yes, Angelica?
No, sorry, I was trying to figure something out. Sorry
Oh,
about that.
no worries. So what do you all think? Social media, absolutely. That's a big one, especially with folks that are working with youth age populations. Social media is a really big one for sure. And so with our youth ambassador group, actually, we've developed a workflow that enables our staff to actually create social media posts based on a health message that we want, you know, uh, this population to know about. And our youth group actually provides us with feedback on various aspects of those posts, especially from a creativity standpoint, as that's sometimes where we're lacking in expertise. But that's really helped us out as well. Our youth also sometimes develop posts for us, which go through our internal approval processes. All right, so I see some more chat messages coming in. So limited to public health messaging only by the county. That's helpful to know. Thank you, David. Schools is a big one, absolutely. Face to face with our harm reduction service program participants. Yeah, so Julia, perhaps you may relate or find some of the navigator work that we're doing maybe informative. As part of our overdose data to action program that I mentioned, we also have what is called a post overdose program, like activity part of it. And that's where our navigators actually connect with individuals who are coming out of emergency departments and helping them with post overdose resources and support. Yeah, community planning groups. Thank you. All right. So so those are effective ways that we chat with or talk with our communities, right? But at some point, I'm sure you all can relate that we do run into barriers as well. So here again, from that ecological standpoint, I've got the barriers showing up at both the micro and the macro level. And especially with some of the work that we've done here with sexual health and harm reduction, at the micro level, patient distress and discomfort, language barriers, as I mentioned, providers also being stretched very thin, and mismanaged healthcare files are some examples of micro level barriers that we've heard and seen within our work. Mismanaged healthcare files, I'm sure that's raising a few maybe internal flags for you all, right? But there is always that, especially with an area like HIV, as I mentioned, right? Because there is so much complexity tied to it. There are also separate laws that are created for how HIV data and health information should be handled, especially when it is newly reported, as well as when a person is in ongoing care. And so, some, vast different experiences that patients have had with that, definitely increases sensitivity for just wanting to know, how is my information being handled? Is it really being kept in a way where I can be assured of my privacy? And then for micro level influences, inequities, hesitancy around seeking services, longer term, looking at health outcomes, tertiary prevention, where individuals present or come to us after they've already started to experience symptoms, right? Where now it's becoming a matter of treatment and care along that continuum of care framework. And then misinformation, like I mentioned. A couple of examples of that I just want to share, because you may also find it as interesting as I did, right? Is working on that prevention method of HIV that I talked about, PrEP. And so we've had actually, primary care providers, especially, sometimes feel like there's ambiguity in their role to provide PrEP or even treat people who have HIV, right? So sometimes, making it clear a little bit more about kind of where this fits in into the different provider roles, because what we don't want to see happening is our navigators are helping our communities get linked into services, and their communities are feeling like this support is really helpful, only to find out that the provider is saying, hey, this is not my area of expertise, right? So we definitely want there to be alignment between traditional public health programming as well as the healthcare delivery system. And then from a clinical standpoint, I think there are a couple of maybe providers in the room as well, or healthcare providers. And so with that standpoint, there's always this academic detailing framework that we use to make sure that clinical trial data, it really makes for an unbiased way for our health educators to go out and make sure providers can see the data behind the medications that are being recommended to either prevent or treat certain conditions. So here I have one approach to addressing barriers in healthcare communication. So this is the BAIDS technique, and this is more geared towards micro level communication. So you see a lot of these questions are around one-on-one patient questions that various providers in those roles can ask, right? So maybe asking a patient about their present situation, like for example, what is going on in your life? Maybe asking about how the patient is feeling emotionally relating to their health concern. What is it about their concern that's affecting them? And so, the other acronyms that are listed here as part of that. So, trouble handling and empathy, right? So, these are all strategies that you may find helpful if you're interval where you work with clients one on one. So, are there any other approaches you all are using now to address some of these communication barriers effectively? Please let me know. Are there any case stories or success stories you have? Anything that's particularly working out well for you all in addressing barriers? I know with federally qualified health centers, the legal requirements around making sure that translation services are available in a multitude of languages has been really helpful to address the language related barriers. Okay, well, if you think of any, feel free to let me know. I'll go ahead and move on. So from here, now that we've laid out the groundwork for just ways in which communication is happening, again, I want us to be thinking about micro and macro levels. I want to talk about the different theoretical frameworks that help guide the development of our messages. So all of this really is about before we communicate, before we start our message development, how do we know that like our goal and our purpose is aligned with where we're seeing our community needs, right? So theory as a guiding framework. This really talks about the scientific development, strategic dissemination, and evaluation of relevant, accurate, accessible, and understandable health information which is communicated to and from intended audiences to advance the public's health. And really, it's just a tool that's within our toolbox that helps organize different messages and what we know about how information flows and travels within our communities that allows us to not only raise awareness, but also predict longer term health outcomes. Now, there's going to be just two main theories that or frameworks that I am going to be introducing to you all as tools that you all can hopefully use after today's workshop. But just know that there's really no single theory that can, do all of the explaining and predicting when it comes to communication. And one of the main big reasons why this is the case is because sometimes we don't always get um, that backward feedback to us, right? Where if we communicate a message from our side, whether it's individually or as an organization, we don't always hear feedback from the community on whether or not that message resonated with them, whether or not it was heard, that message was received, right? And so, because we don't have that feedback loop always in play, that becomes a little bit tough, right? As far as explaining and predicting those outcomes. Now, so before implementing our communication interventions, there are various different models that allow us to understand community needs. And so I'm not going to go over all of these models, but I just want to show them as brief examples, right? So here we have an individual level model of the health belief model, which is also known as a value expectancy theory. So if you are taking notes, it really is just a matter of answering the question through this communication message, what's in it for the community themselves, right? Why should they care? That's really the main kind of point of all of the constructs that you see here on this slide. So health belief model is a really good way to understand, if you are ever doing a needs assessment or maybe even just informal surveying of your community members, where they're at as far as their own assessment of their susceptibility to a particular condition or disease. Where they feel like maybe there is increased severity for them, what they might be reporting to you as far as their overall motivation and wanting to engage in any behavior change efforts, and where they might be expressing to you that there are facilitators or barriers in them actually being able to achieve their desired health goals, right? And so, as part of collecting that information from your community members, you'll have a better idea for where you want to hone in on your messaging, right? Are you hearing maybe some misinformation as you're talking with them? Are you hearing that there is a trend or patterns and certain barriers that you want to help address through your communication campaign? So that's really the purpose of you doing this. Here we have another example of a model. This is called the theory of planned behavior. It was developed by a theorist named Isaac Eisen, who I really kind of give credit to because he introduced this concept of individuals having varying degrees of control over their own lives. So there was a bit of fatalistic worldview that he incorporated into a theory like this. And so sometimes, depending on what you know about your communities that you're working with, you may want to better understand the degree to which they feel like they have that confidence and control to actually take action to achieve their own desired health and behavior change goals. And then the last model here, again, just as a brief example, this one is kind of more leveraging and acknowledging that individuals don't always make decisions by themselves, right? As we saw in the previous two models. And so with this one, this one acknowledges that in addition to our own cognitions and our own kind of, processes that happen in our minds about, what we feel like is a rational choice for us or what feels right for us, right? In addition to that, there's also environmental factors that are main drivers for human behavior. And so you might find this, it's a very popular theory that gets used, but you might find this useful as well, right? And understanding from a needs perspective, needs assessment perspective, the level of access your community has to different services, including being able to understand insurance coverage options, right? Because those get communicated as main barriers a lot of the time. And then this one also talks about behavioral factors, which again, very, very interesting, at least I find, because sometimes having the knowledge and the awareness of what in our mind is good for us and what in our mind we don't really or we're not really interested in, just having that knowledge itself is not enough. And so is there a gap in just having the skills that are needed to maybe go out and achieve the goals that your population may have for themselves? Have they been able to practice those skills so that there's a understanding of a mastery over them? Um, so again, just really useful ways to just think about, what is it that you want your communities to get away from the message that you're putting out there? Which of these constructs, these areas, is it that you want to really focus on? And so once you have a good idea of what that looks like, then you can go into a process called intervention mapping. So now this is where you start to map out what your communication, maybe your social media campaign is going to really look like, right? Because in this mapping process, you see on the slide here, it's a 6-step process. So you've already started to finish out this first step of conducting that needs assessment using those models that I just went over, right? And then from there, you can actually start to work alongside your community members to draft up different framing of the messages. Think about what kind of message effects you want to have, and maybe even engage in a process of audience segmentation, which is beyond the scope of today's workshop because we only have a little bit of time. But honestly, that really just talks about, how different subpopulations within your overall community may find your prevention messaging relevant, right? So, do you need to further tailor those messages so that maybe they're applicable for certain age groups? So, for example, we have a pilot program that we launched 2 years ago, within which we did a pretty massive, large scale social marketing campaign for. And that pilot program was just geared towards individuals who are over the age of 50, so a program for older adults. And so, one thing that kind of just went out the door for us initially is social media. There's not as much utilization of social media among this population group, but the messages are still, they still need to reach them, right? So, it was a pretty amazing process we went through all together as a team on our end to figure out, what that campaign is going to look like and how it's going to vastly be different from other campaigns we've done in the past. So, within my sexual health experience here, we've had the chance, we were very, very involved in the 2022 outbreak of Mpox. And one of our counties was also one that was pretty largely affected. And so there was quite a bit that we had to do as far as prevention, but also response to an outbreak that was occurring at that time. And so here's on this slide, we have an example of intervention mapping, those 6-step process to try and assess need, right? Using the health belief model really as our main model to understand, how is our community doing as far as knowledge and awareness? How is our community doing as far as risk perception and severity of the perception? So I won't go into all of this, but you can see here kind of what was reported through this particular study that was conducted, where the researchers really were intentional about making sure that the surveys and the questionnaires that were developed were aligned with those models, whichever one you choose, so that your results can actually correspond with the framework that you end up using. So here, I just want to call out a couple. So low knowledge and awareness, especially on Mpox symptoms and transmission, understanding own risk of acquiring Mpox, as well as transmitting Mpox to other people. And Mpox sequelae is something that has been talked about as well, and we've probably heard this in the context of COVID-19, where essentially we're talking about prolonged effects or longer term effects of having had a certain condition, in this case, Mpox, right, and what that might look like. So very, very interesting. And then this one here is a study that I personally was the lead on here on our side, looking at reasons for why individuals in our community were hesitant towards getting the Mpox vaccine. So we put out quite a bit of social media posts. It was a very strong partnership with our communications team to try and control that outbreak at that time, right? And ensuring that people were aware of what the vaccine was and what completion of the 2-dose vaccination series looks like and where people can go to actually access the vaccine. And at that time, we were making it available free of cost, right? There were mass vaccination clinics where anyone who was interested could essentially go and get vaccinated. However, our disease investigation team, as we worked with more and more people that were testing positive, also known as Mpox cases, we were interested to understand why, even after putting out social media messages, after making these mass vaccination events available, why folks were still pretty hesitant to get vaccinated. So this is over on the left-hand side, one of the figures that we had created for our research here. And out of all the cases that we had interviewed, actually 77% were aware of Mpox, right, as an emerging infectious disease here locally. However, of those 77%, 56% believed to not be at risk. And the reasons for that are shown in the boxes down below that, right? So maybe didn't think too much about it, was not engaged in sexual activity. Perhaps they thought that maybe this virus was something they were seeing in the news but hadn't made its way into Santa Clara County yet. And there was also a response we got where there was some maybe confusion around the difference between Mpox and smallpox, right? Where thinking that if a person has had smallpox, that makes them immune to Mpox, which is not necessarily the case. And then over on the right-hand side, we also asked about how our cases were receiving information about Mpox. And so, like I mentioned before, our interpersonal communications, the word of mouth information sharing is still very prominent. Even in this day and age of digital devices, even AI, right? But 25% of our cases actually heard about the Mpox vaccine through their friends. 21% heard about it from social media, and then 14% heard about it from their healthcare provider. We did do a lot of news press releases at that time, so that is one reason why you will see 25% also hearing about Mpox in the news, and that tends to happen whenever in our setting we have what is called the emergency response or outbreak control efforts. So I will probably actually, I think I'm running close to time, so let me pause over this and just get to my 2 tools that I want to show you. So once you know your community need, I just want you to know that you have now a couple of different options to now tailor your message and figure out how to actually make sure your community hears about it, right? So the first tool is using this framework called diffusion of innovations. And diffusion of innovations really is a way to actually introduce an innovative idea or an innovative product that you might have. And product in this case is not something for sale, but it's maybe something like a brand new self-test kit for COVID, right? That maybe our community has not seen before, and you really want them to know about it and maybe even encourage uptake, right? And so here's some stages of diffusion of innovations that we use as a guide to facilitate that message. Diffusion of the message essentially into the community, right? So starting with just making sure folks are aware, seeing if persuasion efforts that are part of how the message is tailored help to form an attitude towards the innovation itself. And then ultimately, if those efforts actually lead to a decision where individuals decide to essentially adopt the innovation, at least try it out, right? And if maybe the experience is not optimal or suboptimal, uh, they can go ahead and reject it. So here's, the diffusion curve. We use this for evaluation purposes, again, for large scale campaigns where you do want to reach a majority of individuals in your community. You can actually, kind of like divide up, who in your community is more likely, again, based on what you might know from your needs assessment, who might be more likely to adopt first, be an early adopter, and which, proportions of the rest of the populations are likely to be early and late majorities based on the successes and the trials of the early adopters and innovators. And hopefully, you'll have the slides after today's presentation as well, but using this table also to just make sure that what you can do on your end to be as persuasive as possible in your message includes the characteristics of the innovation that actually matter to other people, right? So a number one question is always around cost. Now, this is interesting because, when we were first starting out in our space, we don't usually charge, and if there is any fee, like for clinic services, it's usually a very low cost fee. But for those services or products that have no cost, it's like our staff already are accustomed to knowing that we're not charging. So that word free just got left out of the social marketing message or the social media message. But our comms team always tells us, like, just because we are accustomed to that doesn't mean automatically that our community will know, right? So you really want to make it clear, is it free, or is there something that, they will be asked to pay? Other things like relative advantage, the extent to which this innovation that you're introducing will actually work for your priority populations, making it as simple as possible, because we do know people tend to maybe, if it's too big of a process to adopt something new, not everyone maybe will have the time for it, or maybe there could be challenges in understanding, right, how to adopt this innovation. So one really easy example of this is, we had launched a brand new HIV self-testing campaign, and we wanted to collect as much data as possible from our community partners, our community members, when they've signed up to get access to a test. And the survey was just so long that people actually were exiting the survey because it was just not simple enough, right, to access that test kit. So we definitely had to make some modifications. And then lastly, compatibility, right? So compatibility from the standpoint of, does it fit well within um, our community's kind of day to day, right? Or is this going to completely shift how they go about maybe, their day to day activities? Um, and then, we also have observability and trialability, which I've talked about, where, some folks, they like to see the behavior of the product actually being modeled. So when we introduced our self-test campaign, I did a press release with our comms team, and actually with the reporter held up what the test kit looks like, and opened up the box and showed them the step-by-step process on how to conduct a self-test for HIV, and then how to actually interpret the results. So having short videos like that is really, really helpful. All right, so the second tool is social marketing. So this is essentially what it is the application of commercial marketing technologies now into the public health space. And with social marketing, I just have two things that I want to share. Is the first is the traditional what we might know about how marketing in general works for business, right? Where you have how you're going to promote the product, right? How you're going to make it visually appealing, kind of all those elements of what goes into a successful campaign essentially are what hold true here with social marketing as a public health communication strategy. Now, the key difference with this is that instead of encouraging purchasing behavior, which we see over on the left hand side under commercial marketing, we are actually aiming to influence a broader range of outcomes, which might include things like attitudes, priorities, and behaviors among our priority population. So here we've got just the basic principles of social marketing. Again, I know I'm very close on time, so I won't go through all of these, but I just want to touch on number 4 here, which is a big moment for social marketing, is making sure that the 4 Ps of traditional marketing are always present in our campaign. So if you do anything when you are, just bare minimum, just make sure that you at least have the price listed, that you at least have the place shown always, like where do people go to access whatever it is you're putting out there. What is the actual product? Is it a service or is it something like a test kit? And then lastly, thinking through promotion as the 4th P, right? How are you going to promote that message? Is it through a Instagram, through Facebook, social media, or in my case, we also market on dating apps. We also market on different adult websites, right? Where people may be more likely to see the message who are from our priority population. Okay, so in these last few minutes, I'm going to go over a few case examples of communication campaigns that have been fairly successful for us. And then I'll go ahead and stop for questions. Thank you for bearing with me up until now. All right, so the first one, I've been alluding to this. So here is our amazing HIV self-testing program. Now, this was launched during COVID-19, and it was specifically made available because so many of our testing services had actually stopped because of redirection of clinical staff to the COVID response. And so we understood that the detriment of that actually is less people knowing their status and perhaps an increased risk of community transmission of HIV during that time. So for us, it's an innovation because this is a brand new program that our community had not seen before. And even though self-test kits have been FDA approved since 2012, again, we had never adopted this as an approach, right? So we wanted to encourage adoption of this among our priority populations. So the way that we diffused this program is use of dating apps, putting advertisements there. We also did program newsletters because a lot of folks were actually subscribed to receive information about our services. Social media, of course, was a big one. And then, like I mentioned, I also did a press release to announce this new program through various news outlets, especially ABC News and Univision, which is a station that provides news information in Spanish, especially given more than 95% of our current clients are Spanish speaking. And then, of course, on our website. Always having our goals in mind. I listed the goals related to our campaign here, right? Knowing that our main thing was just to raise awareness. Number 2 was making sure people felt comfortable, right? And getting a test result about HIV. Oops, I have awareness on there twice. Sorry about that. And then also, again, because of our concern about people not knowing their status and potentially risking additional community transmission, wanted to make sure we could prevent that. So over on the right-hand side, we have a publication that we had put out evaluating this pilot program. So if anyone's interested in some more of kind of the details around what this is about, it also has a workflow of how we had brought this program available to our priority population and how people could access it, and at which points our staff actually reached out, conducted outreach to individuals who requested different services. Um, different services from our program. Now, this evaluation was specifically focused on which strategies for marketing ended up being the most effective to raise awareness. So you'll see some of the statistics around effective communication strategies listed here. And then over on the left-hand side, just aligned with diffusion of innovations, we, showed the compatibility of just how easy it is to conduct a test. We also showed the simplicity of it by providing a step-by-step tutorial on taking the test. And trialability and observability was really helpful because we never want to have somebody essentially be subscribed to receiving self-test kits and not have a way out, right? So individuals could always just, ask for a test, even anonymously if they wanted to. And if they don't like their experience, no one's saying, hey, you have to get a second test done or a third test done, right? So it's completely autonomous from their standpoint. Now, here I have another campaign example called Get Liberated. So this is promoting HIV PrEP as prevention medication and essentially promoting the message that being on PrEP is liberating. So know your options. So here I have just a few examples of some of the media kind of the posts that were put out through our different media channels as well as on our dating apps. And then on the bottom of each, you can see the reach of our campaigns, right? So over on the left, you have that first post called Get Liberated, Take It, Take PrEP, 2.4 million impressions. The size of Santa Clara County is roughly around 2 million people. So I would say that was really good. PrEP is for shows kind of who anyone essentially can get on PrEP if they want to. So 13.3 million impressions. And then a specific CBO community based organization a led campaign as part of this called Roots Community Health Center, where they had more than 17,000 of their patients see this message on their social media. Now, social marketing messages can actually be really helpful if you're trying to normalize conversation also around a particular topic, right? So, especially in my area here, talking about sex is still seen as taboo, right? And also talking about HIV and PrEP, on a large scale basis, can actually help normalize that conversation and reduce stigma around it. So here I have another example of Aging with HIV Toolkit. So this is that new pilot program that we had launched 2 years ago that I was mentioning briefly earlier on. Now this was our population of focus was individuals who are 50 years of age or older and living with HIV here in Santa Clara County. And so here you see that Facebook and Instagram was part of our strategy. It was part of our toolkit. But also we had other ways that we were trying to reach this population as well. So this is a digital toolkit. So you see website and e-newsletter content showing up here. You can also kind of see the types of like how the post has been created as far as colors, as far as images, as far as the language being used, as well as the hashtags and the information that is shown underneath, right? So very focused on those 4 Ps of marketing, which again, as a bare minimum, I hope that you all can take away as something to always have before you release a message out to your priority populations. Um, Now, here's a few more examples. I wanted to zoom in on these so that you could take a look and offer some, reflections or thoughts on what's kind of standing out to you all on these posts. Like I mentioned, digital campaign was not the main strategy for this population. So we also had in-person outreach happening with Rotary clubs, faith-based organizations, as well as some senior centers and assisted living facilities for the older age brackets, as was expressed by our community committee that actually gave us input on how to actually design this campaign in the first place. Um, so is there anything that stuck out to you all on these posts? Feel free to let me know in the chat. Or anything you feel like maybe we missed that we could have done better for the future, let me know if you have any thoughts. Um, I'm going to also play a video that was part of our HIV and aging campaign. It's a very short, I think around a minute long video. So this was actually placed on YouTube, where as you all probably already know, YouTube is playing ads. It's requiring ads unless you purchase premiums, right? And so our advertising agency actually had a way to figure out, which users would be likely to be part of our priority population, and kind of target these ads, these videos to play during those ads. So let me just very quickly play this. And again, if there's any reactions, let me know.
Live or work in Santa Clara County? Diagnosed with HIV? At least 50 years old? Santa Clara County Getting to Zero's HIV and Aging program wants you to know we're here to help. Get free medical and social services regardless of insurance. Time to live your best life. To learn more, call us or go online.
Yeah, very brief, but you can kind of get the idea of how we were doing the campaign. So again, if you have any feedback, any reflections, let me know. And then, so here's a couple of additional social media messages. So these were particularly put on our Instagram page. So over on the left-hand side, this is part of that MPOX response effort that I was telling you all about. So this was, a post that was also put out during our Pride months. So that's usually around the summertime, June, July, when we have Pride here, our Pride event here in Santa Clara County. And so in anticipation for a potential spike in cases around that time, we really wanted to make sure that Pride messaging was integrated, but also MPOX messaging was included as part of that. And then also from a service standpoint, making sure, again, what is it that we're asking our population, right? So if we're asking them to get vaccinated, if they are to attend Pride, is there a vaccine clinic that is set up, maybe as a booth or as a table where, people can actually access and get vaccinated if they wanted to. And then over on the right is just one of our standard posts. So this was actually informed by our youth group who designed this. I thought it was very creative. Orange, you glad you protected your banana? Wearing a condom reduces your risk of getting STIs, including HIV. So again, our call to action here, that word free, and get the free condoms at the Crane Center. Okay, and so this is my last example. So this one has to do with also with our youth group. So we work very closely with our school districts here in Santa Clara County, and there is actually a requirement to make sure that sexual health education is offered to students of who are attending these schools. And so because we have those relationships with those districts, we also do like an annual fun contest just to engage them, because we know from research that gamification, video, anything that is like a game or a contest is something that youth do like to participate in. So here we offered cash prizes for youth to create a short 30 to 90-second video of a sexual health prevention message. And there was a panel of judges that were also comprised of other youth who, once all the submissions were received, they would actually, evaluate each of the videos and then offer a first, second, and third place prize to the winners who had, the most creative video. So here's an advertisement that we had posted on YouTube to promote this event.
Did you know that 15 to 24-year-olds now account for half of all new sexually transmitted infection cases? Do you want to be part of the solution? If you're a high school student in Santa Clara County, you can win up to $1,500 cash plus $500 for your school by taking part in the viral video contest. Simply record a 30 to 90-second video that explains the importance of safer sexual behavior or addresses the stigma around STIs and regular sexual health screenings. Post it to YouTube and share it using the hashtag #GoViralSCC. Then submit your application online at goviralscc.org. If you're the lucky winner, your video may go viral in a public health PSA and STI awareness week in April. What are you waiting for? Recording a video is easier and faster than you think. For rules and complete details, visit goviralscc.org.
Okay. So if you have any thoughts, let me know what you all think. Would love to hear it. We offer this contest every single year. And again, with always knowing again, our goal in mind, but it's always been very, very popular among our students.
Did you know?
All right, so that goes ahead and brings me to a wrap in this presentation. So I want to thank you all again for sticking with me. So here are the main kind of take-home messages I'd love to leave you all with. So the first is, as we talked about, understanding the range of information sources that your priority population is exposed to. Making sure that you do, collect community input on how your community likes to receive information, as that will inform the outlets through which maybe your messages should flow through. And so conducting a needs assessment to figure out that piece, as well as if there are any other gaps within, let's say, your community's awareness, knowledge, or skills, those actually will translate into your campaign goals using some of the models that I had covered in that section. And once you understand your goals, then you can use one of the two theoretical frameworks. Number one, diffusion of innovations. Number two, social marketing, to guide development of your message as well as your campaign strategy. Use the matrix, a marketing matrix, that is your 4 Ps. Again, that is price, promotion, place, and product, to ensure that that basic information is included in your campaign at a bare minimum. And once you've done that, you are all set. You can go ahead and start launching and evaluating your campaign to see what results you land with. So thank you again for your time today. I hope this information was informative. I've put my contact information here if you'd like to reach me. And from here, I'll go ahead and open it up to any questions. Thanks again.